Wait, is this real? You guys! So judging by that reaction, as you guys can tell, I finally reached 500 subscribers. Thank you guys so much for all of your love and support. We have grown this channel tremendously over the last couple of months. I remember starting my channel for the very first time in October 2019 with the intent of making nursing related content to help you guys fall in love with nursing as much as I am right now. And I know that it's kind of too early to say that, you know, most nurses, they're gonna go around and tell me, you know, Christian, you're too young. You've only been working as a nurse for 2 years right now. Try working as a nurse for 5 to 10 years. You're just gonna hate this field. But that's not the case, guys, because you know what? I love this field. I love this job. And if I can show you guys how much I love this field of nursing as much as I love it right now, then I have done my job as a nurse educator and as a nurse vlogger, because that's why I make this content. I make this content to help educate you guys, and I want to encourage you guys to go for this field because it's an amazing field with many opportunities and many opportunities to grow. Alright, I better stop before I get a little bit sappy, but anyways, before I get into the nitty-gritty of this video, I want to show you guys what just came in the mail the other day. And I was super excited to get this in the mail because this was something that I was waiting for a very long time. And let me just show you guys real quick the first couple of items that I got. So the first item I got was these nice, awesome pens. As you can tell, it has the official UNLV School of Nursing, if you guys can see that right there. And then you got another pen right here. It says hashtag UNLV Nursing. I'm super excited to start there. I also got these cool keyboard tech tattoos. Now I don't know if I'm actually going to use these on my laptop, but you know, these are pretty cool. You know, if you get these and you're trying to rep your school, you know, by all means go for it. Now my favorite part was definitely this. I got my badge, but I'm gonna hide my student ID so you guys don't, you know, try to hack me or anything. But anyways, I got my student ID. I took this picture a while back for my passport, so I decided to end up using it because I wanted a nice photo on my badge, because I remember when I first went to university, it was like a hot day, I was sweating, my hair wasn't even done, it wasn't even fixed, I looked pretty weird in that badge, so I wanted to make sure that I looked pretty good in this picture. Anyways, last but not least, the piece de la resistance, ladies and gentlemen, oh my bad, was the badge. Now, check this out guys, as you can see, it officially says Christian C, APRN student. I know it's kind of a blurry, but you know, it's kind of funny. When you go into a job for the very first time, you don't feel actually official until you get the badge. Because when you go to the hospital for the very first time, what is the one thing that they check? They check your badge. Now with the badge, I finally got in the mail. I finally got my student badge. So when I'm walking around, you know, at the hospitals, and I'm walking around doing these clinical preceptorships, they know what school I rep, and they know that I'm an APRN student. All right, let me just put this down right there so I can talk to you guys. Anyways, so guys, as you know by the title of this video, for the very first time I got to step into the ICU floor. So it was officially my very first week working on the ICU floor for the very first time. Now, I know over the last 2 weeks I've been going into training. And if you guys have been following under social media, I've been doing preceptorship classes, which is a prereq before you actually get to start on the floor. So most of the time, depending on your training program, sometimes you're going to end up doing preceptorship classes where you kind of get a crash course on the different systems. But because of COVID-19 and all of that, a lot of the education has been now converted to online resources. So the resources that I'm doing right now, it's called ECHO modules, and the ECHO modules took many hours to complete, many days, but basically it covers every single major system: the cardiovascular, respiratory, renal, lungs, everything. And it kind of gave you a crash course on understanding, you know, how these different systems work, what are the different drugs, what to you expect to go into the ICU for the very first time. And in combination to that, I was also able to get a couple of in-person classes by a phenomenal instructor, by the way. She's great, who was able to, you know, give me a refresher on how to interpret EKGs, how to interpret all these different readings and results. So before I was able to actually step into the ICU floor, I was able to get a taste and also kind of figure out what to expect when going into it for the very first time. Now, when I got into the ICU floor, guys, I'm not gonna lie, it was pretty nerve-wracking. You know, even though I've been working as a nurse for about 2 years or so, as an IMC nurse, which I'm very grateful, by the way. You know, there is so much for me that I don't even know about this great field of nursing. You know, there's so much knowledge, there's so much information to absorb. And when I went into the floor for the very first time, I'm not gonna lie, it was very scary because, one, I'd never been on the floor except when I upgraded a patient from a rapid response or code blue. But when I got to the floor for the very first time, I was able to meet my preceptor, and I also got to see my patients for the first time. And compared to IMC, where patients are more walkie-talkie, they're awake, they're alert, they know what's going on, they're able to talk to you, discuss their problems. A lot of the patients that I interacted with, and my very first one I'm going to tell you about, was on a ventilator and was on 4 to 5, 6 different medications that I never personally heard of. So it was a little bit scary seeing for the very first time, but you know, it was something that I just needed to get adjusted to and acclimated to. And my preceptor, who I met for the very first time as well, kind of said it best. He said, you know, Christian, you have been an IMC nurse, you've worked as a nurse already, you have the experience, you know how to be a nurse. But what I'm going to teach you in these last 3 months of preceptorship is how to think and how to become an ICU nurse. And when I've heard that for the very first time from my preceptor, I was super excited, but also a little bit scared, because it's like, wow, you know, there's actually a different way of thinking. There's a different way of processing. There's a different way of assessing all this different knowledge. So when that preceptor told me that, you know, I was going to learn new things, you know, adapt to a new environment, I was ready, but I was also nervous, as any ICU nurse ever should be. So let me tell you guys, the very first patient that I had was a patient that was on a ventilator, 4 to 5 different medications. And I learned all these different meds in class, and also got a crash course from my preceptor. And the meds that this patient was on, Levophed, he was on cleviprex, fentanyl, Versed, a bunch of different medications. And in future videos, guys, I'm definitely gonna, you know, share with you guys how these different medications work. But before I kind of, you know, explain what it is, I want to be able to grasp it 100%, because it wouldn't make sense for me to teach and explain it to you guys without understanding it fully first. So, you know, I'll delve in that to a different topic. But this patient of mine was on different types of medications. The purpose of these medications and also was to help keep the patient stable, because after all, this patient was on a ventilator, didn't know what was going on, completely obtunded, so very sedated. And also, in the slightest movement I noticed when you tried to move around this patient, when you tried to, you know, create pain responses, this patient would move, but it would also increase the heart rate and breathing rate. So a lot of these medications is to stabilize that. And from what I learned is you like to start off with medications such as pain, such as the fentanyl and Versed, because most of the time when patients are, you know, erratic, they're freaking out, it's because, you know, they're on a vent, they're intubated, they don't know what's going on, so you want to give them some pain medication to help relax them. The second part of it is when you're giving all these meds, what happens is it decreases the blood pressure, so you want to put patients on medications like the norepinephrine, the Levophed, etc., to keep these blood pressures and to keep it stabilized. In addition to that, cleviprex, from what I learned, was a medication that helps wean patients off of the ventilator to eventually, with the goal of taking them off, which is the term called extubation. So I got a crash course. That was kind of a quick, you know, lesson that I got on all these different meds. But this patient was very unstable for the most part, and it was very scary, because when I was talking to my ICU colleagues, this was a patient that was actually talking, was actually interacting, waving at people the week prior. So it kind of just puts into perspective, you know, how crazy it is when you're going into an ICU unit. You know, for one day, your patient could be normal, but as you blink, all of a sudden your patient could go down south, your patient codes, your patient rapids, and you have to put your patient on a ton of different medications just to stabilize them. So this is what I kind of learned, and also what I got to see on my very first time experience on the ICU unit. And the biggest difference too that I've learned, you know, apart from IMC, because even though I've got to work with vent patients before, this was the very first week I got to titrate medications. And if you don't know what titration is the ability to move up and down medications, you know, based on the patient's level of consciousness, their, you know, their level of sedation, how they're feeling, their level of pain, their breathing. We have this scale, and the scale that we use in ICU is something called a Rast Score. And that Rast Score is something that we use to determine, you know, whether or not to increase or titrate the medication. So I got to learn that for the very first time. I got into it. My preceptor actually let me titrate. He said, Christian, take a look at the patient. I want you to figure out, you know, what do you want to do right now? You see that the patient is riding the ventilator, meaning, you know, he's depending on the ventilator to breathe. what are you going to do? Are you going to increase the amount of sedation, or are you going to try to decrease the sedation? And so I had to think long and hard about it, and I thought about, you know what, this patient is very relaxed, the heart rate is stable, the breathing rate is stable. Let's see how he or she does, you know, with the sedation a little bit lowered. Because in actuality, guys, you don't want to have a patient to be completely 100% on these strong ICU medications. The goal, of course, is you want to stabilize the patient. You want to wean down these medications eventually. And if the patient can come off all of these medications and also be able to come off in the tube, then that's phenomenal. You know, they could be reunited with their families, they can go home, and they could be much better. So at the end of the day, guys, the biggest takeaway that I learned from an ICU floor was the importance of stabilizing your patient, understanding how different medications work, understanding, you know, the wide spectrum of critical thinking, being able to predict what happens next. If my patient is on this medication, what do I expect? You know, what do I need to give to reverse it? If my patient overdoses, if my patient has a reaction to it, what do I need to do? This is the type of thinking that my preceptor wanted to adopt to me, you know, not, of course, not right away, but over the last 3 months of my preceptorship. So by hopefully at the end of my preceptorship, I'll be able to understand what's going on. I'll be able to, you know, be more independent and be more competent as an ICU nurse, because that's what I want to be. I want to be the best nurse I can possibly be, and I want to be an ICU nurse that my patients and also my coworkers can trust. So when I'm giving reports, these nurses and everyone that I'm giving a report to, they'll be like, you know what, this guy, he knows what he's doing. I trust him. I want to be like that. So you guys, with this, in this process, of course, it's going to take some time. It's going to take some knowledge. And also, I'm going to be having to balance the fact that I'm going through school and I'm going through ICU at the same time. So it's going to be a little bit difficult. Wish me luck, guys. I hope I can do it. You know, people call me crazy for doing full-time school and full-time ICU, but you know what? Your boy needs to grind, and I know in my heart that deep down inside, I can do it. As long as I put my heart and I put my mind into it, I can accomplish anything. So last but not least, something else I wanted to share before I end this video was that I actually completed my very first Master's in Nursing paper. You know, when you go into master's programs and all of that, master's programs, DNPs, whatever it is, your doctorate, a lot of the focus is more so on research and also, you know, papers. So I knew for a fact that when I was going to go into my master's program, I want to be working on a lot of papers. It's going to be drowning in papers week after week, and I'm going to have to be able to understand and maneuver, you know, APA, and also the fact that we just switched from 6th edition to 7th edition, so it is a wide different change. There's so many big differences in APA format, so I got to learn about that. But anyways, guys, I wanted to show you guys real quickly my paper that I got to write. So if you've been following me on social media, on Instagram, I decided to dedicate my very first master's paper on the late Chadwick Boseman, and something that I realized, you know, was the importance, you know, that a lesson that we could learn from Chadwick Boseman was that no one actually knew that he had colorectal cancer. No one recognized that he developed the signs, that he exhibited the signs, symptoms, of colorectal cancer. So it came to everyone as a relative surprise, to the world, to the media. Only his friends and family knew. So I wanted to dedicate this paper, my very first master paper, in fact, to the late Chadwick Boseman. And if you guys want to show you guys real quick, I titled my paper Wakanda Forever, and this is how APA format, guys. You always have to have a title page. You have your numbers displayed. You have your title on the very top. I started off with a pretty bomb intro, and then I tied it to a nursing theory because that was the assignment. In this case, I tied it to Leninger's critic culture care theory, which was something interesting that I got to study up and read about prior to writing this paper. I connected it to the importance of colorectal screenings, the different types of alternatives, and came up with a plan of action. So in this case, for my paper, I talked about the importance of helping patients realize what are the signs and symptoms of colorectal cancer, and also offering alternatives, because usually the #1 tool to diagnose colorectal cancer or colon cancer in general is the colonoscopy, but everyone is not all about that. You know, the colonoscopy, you have to completely flush out your bowels, you can't eat overnight, and it's not comfortable. Imagine sticking up a tube down I don't want to get into detail, but anyways, they get a better picture of what's going on, you know, in your system. And with the colonoscopy, because they get a great picture, they're able to sometimes, you know, take a look if there's any lesions or ulcerations. And most of the time, they're able to remove it to prevent cancer from getting worse. So if you're able to do so, of course, colonoscopy is going to be good. But at the same time, as a patient educator, as a nurse, as a doctor, you want to be able to provide alternatives such as other screenings, the stool samplings, and all of that. Because at the end of the day, We want to promote screening, not scare people away from it. So that was a big takeaway in my paper, and I hope that my classmates get a kick out of this paper as much as I did writing it. So very excited, guys. This is the very first paper of many, and I'm gonna end this video right now. Thank you guys so much for watching this weekly update of what's going on with my life, what's going on with nursing school, what's going on with work, and I promise I'm gonna keep updating you guys on a weekly basis about how everything is going. Please subscribe to this channel, smash that like button, leave a comment below if you have any questions or concerns. Until next time, take care, guys.
Busting through the bears that try to contain me. Moving on up, making moves of money endlessly. How you think I got this name? C Money, it's my specialty.